So I'm Dr. Vinita Agrawal. I'm from the Department of Pathology. I'm presently the Member Secretary of the Institutional Ethics Committee. So it is important to understand what is research ethics. I hope all of you understand that it is important that we treat our participants as we would like to treat ourselves. So when we look at research ethics, these are ethical issues that are raised when people are involved as participants in a research. Remember that for research, whenever you are using, whenever you have enrollment of a patient population, so we talk to them as participants. We are not talking to them as patients in most of the places, because you may have controls, you may have patients, you may have pregnant females. So all of them are not patients. So the error that we commonly find is that you quote your participants as patients. So that is the first thing that you should remember. Of course, the objectives are to protect the dignity, rights, and safety of the participants. So what we are trying to do in an ethics committee is safeguard the rights of the participants as well as of the researcher. And when I say researcher, it is the student and the PI. For our institute, the principal investigator is always a faculty member, right? So in whichever department you are, you will have a thesis or a project guide, and that faculty member will be the principal investigator and you will be the student of that research project. So that is how it goes. And it is important to safeguard the rights of both the participants and the principal investigator, the faculty member, and of course the student who is participating in the research. So basically the basic ethical principles that you need to remember, and I think you should remember these 4 principles, which are true for research also. In the end, why are you laughing? The person in the middle, something you wanted to crack a joke? Why are you laughing? The person was, any joke you can tell us, all of us, so that all of us can smile and laugh? Okay. So the basic ethical principles that we need to remember is autonomy. One is that autonomy of the participant has to be maintained, that he or she must be able to decide whether he or she wants to take part in the research project or not. This is something which is very important as far as the participant is involved. The other thing is beneficence. That is, we try to do a research project or a research thing which has a benefit for the participant or benefit for the community. Sometimes there are projects which do not have a direct benefit for the participants, but in a larger way they have some benefit to the scientific community. So that is also part of the benefit. But when you are talking of benefit, we need to remember that it should be, the basic principle is do no harm. You should not harm in any way any of the participants who are involved in the study. And of course, justice in all forms, whether a particular participant has to be involved, not to be involved, whether a pregnant female has to be involved in a research project or not, whether there are vulnerable participants who are involved. So that is how you need to decide whether this participant justifies to be part of the study, whether he or she will get benefit, or whether what is the benefit that is there and there is no harm to the participant. So these are the basic 4 principles which are applicable also to research. So one thing which you need to know is, you will be asked when you fill up the form, what is the risk involved in this? So for our daily life, like we drive a car, someone will give a sample of blood, something like this is known as minimal risk. So whatever you do daily, that is, you're walking on the road, you're driving, you're doing something, everything has some amount of risk in life. So that is the minimal risk which is taken into account. Anything which is less than that risk is known as less than minimal risk. Like for example, you plan to do a retrospective study, you do a meta-analysis, that is less than minimal risk. You are doing something which is already, some data which is already there in the public domain. You are just taking out data from the HIS which is completely anonymized. That is all less than minimal risk, right? So whenever you fill up a form or you're required to tell about a study, you will be asked what is the risk involved. So you should remember that this is less than minimal risk. The routine risk that is there for a sample collection or daily lives is a minimal risk. When there is a low risk, for example, there are patients whom you want to do an MRI, you want to do a CT scan. So that when you are doing some type of an exposure, that will always come into a low risk. And a high risk is something where you do an interventional study. For example, you want to take a liver biopsy for your project, you want to take a mucosal biopsy which is not indicated as such for the treatment of the patients, that will come into a high risk. Or you are giving a drug for something which is not typically given at present. So it is a new drug which you are trying to see, a new device that you are trying to see, that will come in the high risk category. So whenever you have a research project, you need to decide what is the risk involved. And this is one of the most important things that you need to remember. What does the bioethics cell do? We receive all projects from different areas, and we have to review these projects in all parts, that we review it for ethical completeness, for scientific, and for legal issues. Okay, legal, what do you think can be a legal issue? Someone? You're doing a research study, what can be a legal issue? I said we review the projects for ethical, scientific, you I think understand. What can be a legal issue involved? Good. It may be a consent not taken, the consent form has not been properly devised. There is, okay. Right, good. So this is especially true as said by the candidate, by Dr. Ajit, that if you have something you're doing especially for drug and device trials, you are trying to use a new drug, you're trying to use a new device, there may be legal issues which come into being, because you have to see that everything has been done in a proper way. So these CTA, basically it comes into play when there is a sponsor for a trial. What happens when there is a sponsor? That sponsor has a commercial angle to the drug or the device that is being used, and therefore legal issues come into being. And that is why these are also discussed in the bioethics cell whenever we have our institutional ethics committee. And therefore, as a part of our ethics committee, we have the lawyers who are part of the ethics committee. So that is a part of ethics, and that is very important to be understood. Apart from preparation, maintenance, we also have to organize the tracking of each proposal. There are SOPs that are there. I'll show you the standard operating procedures of the ethics cell. We need to organize the ethics meetings, and of course communicate with the members and with the principal investigators, and of course training is also an important part of the ethics committee. So what we get for as projects, as research projects, we either review them in a full board meeting. Some of them are done on expedite review, and some of them may be exempted from review. So expedite review is done especially for DM, for MD projects, DM and MCH projects, in which there is hardly any risk involved. As I told you earlier, either a minimal risk or less than minimal risk is involved. Whenever you go to a low risk or a high risk type of a research study, we will do a regular or a full board review, and therefore you need to remember what is the risk involved. Some of the studies can even be exempt from review. In the COVID era, you must have done, anybody of you did a survey? There were a lot of surveys which were being floated, right? So some of these surveys were part of the exemption from review type of a study, because they were not causing any risk to someone who is doing a survey, provided the data is completely anonymized. Okay, so once you submit a project to the ethics cell, we also give a number to your project, and you need to remember this not remember, that is there on your ethics submission, with the letter that you get from us, the decision letter, but you need to understand what does it explain like. So because sometimes when you have a publication from these projects, you are required to enter this number. Basically, it has these 4 numbers. So one is the year. So for example, you will submit a research project in year 2022. So when you see your letter, you will see that it is written as 2022. Those who will submit in 23, it goes as 2023. This is the number of the project. So it is of course a serial number. So we keep on progressing from one number to another. So this is the serial number. This is the type of project that we receive. For IMP is an intramural project, extramural project, a DM project, similarly an MCH project, and MD project. So that is how we give the numbers to these projects, and this is the meeting number. The end is the meeting number. So if it is just written as 99, that means it has gone to a full board review. If it is written EXP 42, 43, 45, that it means it has gone to the expedite committee, and that is how it has been reviewed. So once you get your decision letter, when you submit your projects, try to look on these numbers and try to make a sense of what are these numbers. So this is the website. This was an old website where we had something here which is still working, but this is where we had the bioethics cell hyperlink. Now we have a new website, and if you go to the research, there is a tab that is research tab. If you pull it out, you will see there is a tab for ethics committee. When you press this, you have this page which comes in, which talks about the human ethics committee. I'm talking of the human ethics committee today. So we have these links where you have the download SOP. SOP, as I said earlier, is the standard operating procedures of the bioethics cell. The forms which are not available on this platform, you will get it in the SOPs. So once you are looking for a form to be submitted, you can go to the SOPs and take it. Apart from that, you also have certain forms which are available separately. And then you have a tab for proposals for ethics review. So for the past around 3 years, we have stopped taking an offline project submission. We are just having an online project submission for ethics committee. So you have to submit in the proposals for ethic review online and mark it. Every one of you will have to, at some stage in SGPGI, you'll have to submit a project, provided you are asked by your faculty member to submit it. Some of the faculty members submit it themselves, and some may ask the residents who are involved in the project to submit it. But of course, as I talk along, I'll tell you how it is done. So you have to, when you are submitting in online, you have to click on this tab. Okay, so this is the tab for online. And when you click on this, this will be the page that opens up. So this is a separate, it is basically a hyperlink. It goes to a different website. And here this is where the online submission is done. This online submission is done only, as I said earlier, in the name of the PI. And the PI is who? I told you earlier, who is the PI in a project? The faculty, not the professor, the faculty member. They may not be professors. So the faculty member whom you have been allotted the thesis with or the project with is the PI. So every PI is registered on this system, and all your co-PIs are also registered on this system. So whenever you have to enter a project for ethical review, you will have to take the ID of your guide to submit it, or the guide will submit it for you. Got it? So this is how it is done. You do not need to register yourselves, because for us, we need to follow these projects over time. Most of you will complete your course in 3 years and go away. But many of you will not submit the completion report. Many of you will not submit the publication related to you. So that is why we have made that this provision is only for the faculty members who are permanent here, so that we can see the completion report and we can follow it up if the project is pending. Okay, so this is about the online submission. The other thing I already told is the forms which are available. As you click on the download forms, you have different forms which you can download. Okay, so this is the site. Here is where you sign in. You have a password. And then as you go, there is a dashboard which talks about the important documents which are there. So here also you have the general instructions for the online submission. You have an online portal instructions. You have checklist of the document which you need to have before submitting. What are the dates of the full board? This was an earlier presentation. So now we have the dates of the 2022 also full board IC meeting. The SOPs are there, and you have the national ethical guidelines of the ICMR and also for biomedical in for children also. So this is where you have the my projects. For the projects of the PI are all shown. So if you want to add a new project, you say add new project, and this is where you come, and then you need to tell us whether it is a drug device trial, whether it is sponsored or not, who are the co-PIs. So you can keep on adding the co-PIs from this because they're already registered. Is there any collaborator? Who is a collaborator? So a co-PI from any other institution is a collaborator. So if you have a collaborator from other institutions, then you add it here. And of course, you have a student ID where you add your name. So you add student, and of course, there is a CV format which is downloadable. So download the CV format, fill it up and upload it. So that is how it works, whether it is funded or not, and what is the duration of the study. And then you keep on updating in each window. Then you add up the project detail, whether it is an interventional study, observational or experimental, or just a retrospective analysis, whether it is a study from a single center or a multi-center. As soon as you say it is a multi-center, then it means that there is a collaborator, and therefore you need to tell us who's the collaborator. Similarly, the participants information, what are the number of controls that you're using and what is the source of these controls? What are the number of participants? As I said earlier, we don't use the word generally patients, it's the participants. Who are the participants and what is the source? Whether they are patients, what are these patients, which will all come in the inclusion and the exclusion criteria. Whether what is the gender of these participants? Do you have inclusion exclusion criteria? You say yes. Of course, you have to have inclusion exclusion criteria for most of the studies, even if it is a retrospective study. You say yes and then include it in the detailed project. Whether there are any vulnerable participants. What do you understand by vulnerable? Anybody? This is an English word. Who's speaking? Yeah, good. So pregnant women who are vulnerable, they are vulnerable because if you don't know you're using drugs or you're using even a procedure and you're not aware, you may do harm to them. They may not be knowing that this is harmful when I'm pregnant. So they become vulnerable. What else? Neonates, yeah. And very elderly population, children, illiterate. Even illiterate are very vulnerable because they don't know what you are trying to do with them. If you're not explaining to them properly, those people are also vulnerable. Similarly, critical, when you have patients who are in the critical care surroundings, they also are, they don't know what you're going to do. In that ways, you then need to involve their family members, the legally accepted representatives, that is known as an LAR, or parents of the patient who is admitted in critical care. So that is why you need to know what is vulnerable. Even population who are very ill and they are in a chronic illness, they may also be vulnerable. They may think that there is a cure by this new research project, and there will be wonders which will happen with this research project, so I should enroll. But so you should be able to understand what is the vulnerability of the participant, and you should avoid such patients who are vulnerable. Try to explain to them that this is what we are doing, and then also if they are agreeing to participate, then you should enroll them. So that is where autonomy comes in. So you should understand what are the vulnerable population, identify and accordingly manage. So as I said earlier, it is already shown that pregnancy, children, elderly, and all this is there. If it is others, then a new window will open up and you can enter. Similarly, for example, for HIV and all these conditions where sexually transmitted diseases. So these were all considered as vulnerable participants because their data is very secretive and it should not be opened up. It should be completely anonymized. So that is why there are certain communities which are also vulnerable. So that is how you need to understand that what is the vulnerability of the population. Special group subjects. Okay, so this is about the special group subjects, special groups like prisoners and all, students, nurses. So that we have to take into account. The other thing is whether advertising is done. This is generally true for device and drug trials. Do you have specimen collection? If you say yes, for example, you're collecting a blood, you go to the specimen collection tab and then enter what is to be done, whether it is an interventional study. What are the risk and benefit? As I told you earlier, you should identify whether it is a less than minimal, or minor increase, or low risk. Similarly, high risk. And what is the benefit? What are the risk and benefit? This is one important area where you should understand what are the risk of the study and what are the benefits. And your weight towards the benefits should be more than the risk which are involved in the study. And of course, you need to maintain the privacy and confidentiality. Then you come to the informed consent documents. So what are informed consent documents? Anybody? Good. So it is a consent document that the patient or the participant or the control, whoever is being enrolled, agrees to participate in the study. That is a consent form. Apart from the consent form, what else do you have in the informed consent documents? Good. So the patient information document, that is also known as patient information sheet, right? PID or PIS, whatever you may like to use. So these are the two informed consent documents. One is a consent form, second is a PID or a PIS. In case of children, it is not a consent form, it is basically an assent form. Assent form is these are not legally, they are not legally authorized to give a consent. They may not understand the study, but they give an assent form. So there is a separate assent form for children in the age of 7 to 18 years of age. Children less than 7 years of age, they will not give a consent, they will not give an assent. That is given by their legal guardian, that is parents or their legally accepted representative. Okay, then you need to upload the file with the detailed project proposal and of course a short summary of about 500 words. So you paste the short summary here and upload a file of project proposals. Okay, then we go to specimen collection. It is self-explanatory. You tell what is the type of specimen that you want to enter, how much, what is the frequency, everything goes in the specimen collection. Similarly, for interventional studies, most of your DM MCH projects are not interventional, but some of you may try to do a new procedure. So that is where the interventional study column has to be entered. So this, when you say yes there in the first form that I showed you, this will be active. If you say no specimen collection, no intervention study, these forms will not be active. So that you need to remember. Sometimes you want to collect a specimen. If you don't say yes, this will become inactive for specimen collection. So after you've done this, you have to upload certain forms. One is the investigator signature. Again, this is a PI who signs the form. So you can download the form and then upload it after signature. Similarly, you have a conflict of interest form, that is, you can generate it, download it, get it signed and upload it. You have to have a committee approval. So for an SGPGI, every project undergoes a committee approval. For MD students, we have a dean committee for MD projects. So we get a letter from the dean that these are the number of projects which have been approved. So that is how that has to be uploaded on this site. Then you have to have a consent of the PI's department, and that you can generate the letter and then update it. The importance of generating these letters from here is you don't need to do much, because in these, when you download it from here, these letters will already have the title of your study, will have the name of the PI, will have the name of all your co-PIs, and also the name of the student. So that is the advantage of this online system. Otherwise, previously when we had an online system, we ended up filling up every form, everything on the, or you had to do it again and again, even when you're doing it on a computer. And then you final submit, and then the PI will get a list of all the projects that are there. Okay, so these are the different forms these are the things which are important when you are submitting a project for approval. And this was very true when we just had an offline system, but now because we have an online system, many of the forms are not useful now. But yes, you have a prototype for everything. You have for the consent form is there. For a consent form, you don't need to do anything. The consent form is true for SGPGI. We have made a consent form. What you need to do is just write the title of the study. Don't change a consent form or an assent form, except that you may have to change some words related to your study. But for a PID has to be made for each project. We give you a guide of the PID which is available online, that you can take some help from the PID. But for every project, there has to be a different type of a PID. Because your projects will be different, the samples collected will be different, the type of patients or the participants will be different. So, as I said earlier, the informed consent documents is the consent form and the assent form and the PID. What you need to remember, these four things: the subject should be competent, you should have a full disclosure to the participants, they should understand what you're trying to do, and it should be completely voluntary. Autonomy is most important. These are the elements of participant information sheet. When you frame a participant information sheet, you should remember that these points have to be covered. As I said earlier, for a child, it is an assent form and not the consent form. This is a prototype for the patient information sheet. It gives you a format of different questions. But you need to remember that for every project, you don't need to have all these questions. What happens is that all of you just copy this from the website, paste it in your document and just answer some of your questions. This is not to be done. You can delete the questions which are not required for your study. Completely delete the question. It may not be applicable for your study. So what happens is when you're trying to answer each of these questions, you end up giving false information or information which is absolutely not required. Okay, so this is something about the PID. It is just a guide. It is not to be copied and pasted in your documents as such, right? So there are a large number of questions, and you should remember this is true especially for interventional studies where the drug or a device is being used. For a simple study in which you are just taking some data from the patient, you don't need to answer all these 13 to 15 questions. So there are 21 questions, and I see most of you submitting the whole of this sheet and trying to answer all of these questions. Don't do that. You will waste your time and energy, and the PID will come back to you for revision. Okay, so these are the guidelines. This is something which is, I'm giving you just an example of a study in which nothing much has to be done. Suppose you have your patients, you just want to collect 2 ml of blood for something. No intervention, no device trial, nothing, or it is just a retrospective data. We're trying to take up follow-up data from some of your patients. It could just be a simple PID like this, where you are trying to say that this is being done in the hospital. These are patients of this condition. Why are you doing a study? What will you do? You'll collect a follow-up data. You'll collect this amount of blood, whether the patient has to come for follow-up or not, whether there is any risk involved or not in the study, and whether it will change their therapy if you participate in a study. So this is a very simple PID, and for most of your MD, DM, MCH studies, this type of a PID is enough. Don't end up sending us 21 questions and answers to it. Similarly, a Hindi PID. So the problem that we face sitting on this side is about the Hindi PID. All of you are well versed with English because English is a medium of your learning. How many of you know how to type in Hindi? So every one of you will require a Hindi PID. Why? Because most of our patients don't know English. Many of our patients actually don't know. So they may require a Hindi PID. If you are studying in a college in Tamil Nadu, you will also require a PID in Tamil. So you'll have maybe more PID. So it depends on the regional area. So for us in SGPGI, most of our patients know Hindi, so we will have it in Hindi. One day, if you think that we will take only patients who are Bengali, then you will have to type it in Bengali. That is what I'm trying to tell you. How do you decide whether you need a Hindi PID or English PID or a Tamil or a, how do you type in Hindi? That was a basic question. Anybody? I think you know, all of you know something about it. Achha. Thank you for telling me. I didn't know that. So what is that font freedom? Different from Google Translator transliteration or? Okay, so that is font freedom. Okay, nice. I'll try once. So I'll tell you something which I do and I also find it quite easy. So there are 3 ways of typing in Hindi, and 4th is this. Maybe you have different apps which are there, which I'm not aware, but basic knowledge that you have to remember is, one is Hindi transliteration. Okay, so those of you who know Hindi, those of you know Hindi, speaking in Hindi, for those people, if you don't know how to type in Hindi, this is what you need to use. This is very easy to do in. So for example, aapne kaha, if you say aap yahan aaye, for example, so what will you type? You will say aap, AAP, and it will type itself in Hindi. Got my point? So if you know the language, if you can speak in Hindi, you can then type it in English. It will type it for you in English, and then you can just copy it. सबको समझ में आया? Everyone got it? So this is known as Hindi transliteration. So what do? You just go in Google, say Google transliteration. It will give you a Google input tools transliteration, and So for example, I've done यह शोध hepatitis के मरीजों में किया. So typing किया का and ya is difficult, but KIYA is easy for you. So you just say kiya and then it will give you options. Kiye, whatever you want to say, you say this and then you just copy it. Once you've done your, you just copy it and paste it in your document. It's so easy, right? So if you know Hindi, then it is easy for you if you speak Hindi. If you don't speak Hindi, you know only English, but because you have come to LGPGI and you may be required to type in Hindi because you'll have to submit your Hindi PID, what do? You use translation. Okay, so similar procedure, you can use a Google translation. So you know hospital, you want to say in Hindi, what do we say in Hindi? You don't know, then you can just type it hospital, it will tell you hospital and keep on copying. The only thing is with transliteration, it will give you the whole document. You can copy, paste the whole document in the file. In this, you will have to do word by word, right? But maybe you have different apps, as has been told, that can type it completely. Okay. The other way is if you are eager to type, now we have many letters also which have to be typed in Hindi. So you may like to have your fonts also. If you can activate the Kritidev font, then you can type it in Hindi also. And of course, you have now the keyboards which have an option to type in Hindi, right? Hindi and English both. So if you want to do that, that also is possible. But if you want to do something like just a transliteration or translation, that is all you can. The other thing is sometimes you may also ask for a waiver of consent. This is true, especially for retrospective studies where you have no contact with your patients. You are just taking out data from the HIS, then you can ask the ethics committee to give you a waiver of consent. But in those cases also, you have to submit the project. But you don't need to submit the PIDs. There is a form that is a waiver of consent form. You can fill it up and submit and say, why do you want a waiver of consent? So I've already given you an example of what is the areas where you require a waiver of consent form. For example, as a pathologist, we have a large number of blogs which are there for different things. We can just go back to those blogs and see our cases again and do a retrospective analysis. We do not have any contact with the patient, so that will be a waiver of consent that we can ask for. Okay, the only thing when we remember for waiver of consent is it does not adversely affect the rights and welfare. So for example, you should not reveal the identity of the patient. You take out the case report of something from very far behind and reveal the identity of that patient, then that is not acceptable. So that in that case, you will not be given a waiver of consent. Of course, for case reports, you don't need to submit, you need to take a consent from patients now with all those case reports, but case series also, you should not divulge the patient identity, and then you can take a waiver of consent. So these are the national ethical guidelines for ICMR. These are very nice. They're available online on the ICMR website. They're also available in our website. You can download them if you want to read something which you may like to understand. This is something like a new drug and clinical trial rules. It is nice to be aware of it. What are the litigations? How do you deal with patients if you go on in with drug and device trials? Maybe not now, maybe later in your life. So these are also important. These are the standard operating procedures of LGPGIMS. We earlier had the 2007 and then the 2011. The present SOPs are the 2018 SOPs that we have been using from January 2018. These are also available on the website. The forms which I showed you, the link, if you do not get any form in that link, you can go to the SOPs and then you can copy and paste. Okay, so any form you want, SOPs are freely available on the website. Okay, any questions?